Disc herniations in the cervical spine can cause a combination of problems. Sometimes you have neck pain, sometimes you have arm pain, sometimes you get your spinal cord pinched and you don't have a lot of pain at all, but you start having difficulty walking, loss of control of your legs or your bowel or bladder. When the nerve gets pinched on the side, causing pain going either into the shoulder or down the arm, that's called radiculopathy. And you can see on here, it's these nerves on the side that are getting pinched by that disc herniation. When you have a disc herniation that pushes in the center of the spine and you have trouble walking, usually that's called myelopathy, and that's when the spinal cord itself gets pushed. It's not particularly painful, but can cause a lot of progressive neurological deficits. To treat these problems, a common procedure that I do is called an anterior cervical discectomy fusion and plating. That's a long word. Usually you hear the phrase ACDF. But what happens is I take a microscope and I come in with a microscope and I take out this disc that's in between these two vertebral bodies here. And then I drill off all of the disc and the material that's pushed in the bone that's pushing on either the nerves or the spinal cord, and I clean all of that out. After that's all cleaned out, you have a couple different options. One of the options is you can fill a little cage like this with your own bone, and then you put that in as a spacer into that disc space that you just took out. And what that'll create a bony growth between the two vertebral body that you took out. And then usually on top of that, you'll place a plate like this with then screws going in. Another option that you have these are called standalone plates or standalone cages, where you don't have to put a plate on. You put the spacer in between the vertebral bodies, and then you put either blades or screws up into the vertebral body. The third option is for people to have younger, healthier spines and just have a single level of degenerative disc where the disc is herniated out but the rest of their anatomy is okay. Sometimes they can have what's called an artificial disc replacement, and I'm going to just pull this apart. What this is it's these two plates with kind of an artificial disc material in between.